Begin. Question 1. Near the end of an intake session, a client says, "I bought the pills yesterday and plan to take them tonight." What is the counselor's best next treatment planning action? Option A. Finalize the routine depression treatment goals before the client leaves. Option B. Explore childhood experiences that may underlie the depression. Option C. Complete an immediate suicide risk assessment and take protective action. Option D. Ask the client to journal about the urge and return next week. Take a moment to think about your answer. The correct answer is C. Complete an immediate suicide risk assessment and take protective action. Here's why. C is clearly best because immediate safety takes priority over routine treatment planning when a client reports current suicidal intent, a plan, and access to means. Standard goal setting, insight work, or homework should wait until the counselor addresses risk and protection. On NCE-style items, urgent safety concerns override routine plan completion. Question 2. At intake, a client appears sweaty and shaky, says they stopped heavy daily drinking yesterday, has not slept in 3 days, and reports seeing shadows moving in the room. What is the counselor's best next step? Option A. Continue the mental health intake and begin treatment for an anxiety disorder. Option B. Arrange urgent medical evaluation and assess safety before concluding that this is a primary mental disorder. Option C. Assign bipolar disorder because the client has not slept and is experiencing perceptual disturbance. Option D. Teach grounding skills and schedule a routine follow-up session next week. Take a moment to think about your answer. The correct answer is B. Arrange urgent medical evaluation and assess safety before concluding that this is a primary mental disorder. Here's why. B is the best answer because the presentation raises concern for substance withdrawal or another medical issue that may require urgent evaluation. Counselors must consider medical and substance-related rule-outs and refer when symptoms suggest instability outside routine outpatient counseling scope. A and C prematurely label a primary psychiatric disorder, and D underestimates potential medical risk. Question 3. A counselor in private practice has basic generalist training, but no formal training in trauma-focused methods. A new client requests treatment for severe trauma symptoms and specifically asks for EMDR. What is the best counselor action? Option A. Begin EMDR after reading the manual so the client does not lose momentum. Option B. Decline services immediately and provide a referral list without further discussion. Option C. Discuss the limits of the counselor's competence, help the client consider a qualified trauma specialist, and support continuity of care during referral or consultation. Option D. Continue supportive counseling only, reassuring the client that a strong therapeutic alliance is sufficient, and intentionally defer any discussion of EMDR or other specialized trauma care. Take a moment to think about your answer. The correct answer is C. Discuss the limits of the counselor's competence, help the client consider a qualified trauma specialist, and support continuity of care during referral or consultation. Here's why. C is correct because counselors should practice within their competence and address client needs transparently. When specialized treatment requested or needed exceeds competence, the counselor should discuss limits, consider consultation or referral, and avoid abandonment by supporting continuity of care. A exceeds competence, B is too abrupt and risks abandonment, and D ignores an important clinical and ethical issue. Question 4. Near the end of a session, a client has discussed conflict with a partner, pressure at work, and fear of disappointing parents. Which counselor response best uses summarization? Option A. You seem stressed. Option B. Today you've connected work pressure and family expectations with the tension showing up in your relationship. Where would you like to focus next time? Option C. Given everything you've shared about your partner, your job, and your parents, isn't the most appropriate next step to commit to firmly confronting each of them? Option D. So your partner is the main problem. Take a moment to think about your answer. The correct answer is B. Today you've connected work pressure and family expectations with the tension showing up in your relationship. Where would you like to focus next time? Here's why. B is the best summary because it pulls together the major themes from the session and links them in a coherent way. A good summarization condenses content and meaning to support clarity, transition, and future focus. A is too vague and functions more like a simple reflection. C is advice-giving rather than summarizing. D oversimplifies and distorts the broader pattern the client described. Question 5. A 15-year-old who recently immigrated reports headaches, social withdrawal at school, and a drop in grades over the past month. The student also describes being mocked for an accent and feeling pressure to translate for family members. What is the best initial case conceptualization? Option A. The student is likely oppositional and needs a behavior contract. Option B. The student may be reacting to acculturation stress and discrimination, so the counselor should assess supports, safety, and mood before assigning a disorder label. Option C. The grade decline is enough to conclude a depressive disorder. Option D. The presentation clearly indicates social anxiety, so the counselor should diagnose it immediately and move directly into exposure-based interventions as the primary treatment. Take a moment to think about your answer. The correct answer is B. The student may be reacting to acculturation stress and discrimination, so the counselor should assess supports, safety, and mood before assigning a disorder label. Here's why. B is the best answer because it integrates cultural, environmental, and developmental context into the case formulation, instead of pathologizing the student too quickly. The symptoms warrant attention, but the counselor should first understand the role of immigration stress, bullying, family responsibility, support systems, and mood before narrowing to a diagnosis or intervention. A ignores the context. C overreaches from limited information. D selects a specific treatment direction before adequate assessment. Question 6. A client says, "Ever since I changed schools, I eat lunch alone and keep thinking nobody wants me around." Which counselor response is the best example of a reflection of feeling? Option A. You're feeling hurt and isolated since the move. Option B. Since changing schools, you've been eating lunch alone and thinking others do not want you there. Option C. So far, you've described changing schools, eating alone, and worrying about fitting in. Option D. What have you tried so far to meet new people? Take a moment to think about your answer. The correct answer is A. You're feeling hurt and isolated since the move. Here's why. A is the best answer because it focuses on the client's emotional experience, which is the defining function of a reflection of feeling. The stem communicates loneliness, hurt, and isolation, and this response names that effect in a concise, empathetic way. B is a paraphrase because it restates the content and meaning of the client's statement without emphasizing the emotion. C is closer to a summary because it pulls together several pieces of material into a broader recap. D is an open question that may be useful later, but it shifts too quickly to problem solving rather than first communicating empathetic understanding. Question 7. A client says, "If I make one mistake at work, I'm a total failure." Which intervention is most consistent with CBT? Option A. Explore how birth order and family roles shaped perfectionism. Option B. Ask the client to track the thought, associated feelings, and behaviors when mistakes happen. Option C. Ask the client to describe a preferred future in which self-doubt is no longer present. Option D. Maintain non-directive silence so the client can lead entirely without structure. Take a moment to think about your answer. The correct answer is B. Ask the client to track the thought, associated feelings, and behaviors when mistakes happen. Here's why. B is best because CBT focuses on the connection among thoughts, feelings, and behaviors. Tracking the automatic thought and its emotional and behavioral consequences is a classic CBT intervention. A is more Adlerian or psychodynamic in flavor. C is solution-focused. D may fit a more non-directive, person-centered stance, but it does not reflect the active cognitive behavioral focus described in the STEM. Question 8. A client says, "I really need to stop drinking," but later says that most evenings are spent at bars with friends and that giving this up feels impossible. Which counselor response is best? Option A. You say you want change, but your behavior shows you are not serious. Option B. Part of you wants to cut back, and part of you worries about losing an important social routine. Option C. To strengthen your resolve, you should stop seeing those friends entirely for a month as a firm test of commitment. Option D. Why would you keep going to bars if sobriety matters to you? Take a moment to think about your answer. The correct answer is B. Part of you wants to cut back, and part of you worries about losing an important social routine. Here's why. B is best because it reflects ambivalence and gently highlights discrepancy in a way that is consistent with motivational interviewing and empathic confrontation. It preserves alliance while helping the client hear both sides of the struggle. A is a shaming confrontation, likely to increase defensiveness. C jumps to advice before fully exploring motivation and barriers. D can sound accusatory and may evoke self-defense rather than change talk. Question 9. A client asks whether to stop taking an antidepressant because of side effects. Which action is within the counselor's scope? Option A. Encourage the client to discuss the side effects promptly with the prescriber and coordinate care with permission. Option B. Recommend reducing the dose over the next week. Option C. Tell the client to stop the medication immediately. Option D. Recommend the client discontinue the antidepressant and transition to an herbal supplement regimen you researched online independently. Take a moment to think about your answer. The correct answer is A. Encourage the client to discuss the side effects promptly with the prescriber and coordinate care with permission. Here's why. A is the best answer because counselors may discuss client concerns, provide support, and coordinate with prescribers within scope, but they do not prescribe or direct medication regimens. B and C are medication management instructions outside counseling scope. D is also an out-of-scope treatment recommendation and may mislead the client into substituting the counselor's medical judgment for a prescriber's. Question 10. During an intake session, a client says, "I bought pills yesterday, and I've been thinking about taking them tonight." What should the counselor do first? Option A. Explore the events that led to the client's sadness in more detail. Option B. Conduct an immediate suicide risk assessment and take protective action as needed. Option C. Begin developing long-term treatment goals for depression. Option D. Ask the client to sign a no-harm contract and return next week. Take a moment to think about your answer. The correct answer is B. Conduct an immediate suicide risk assessment and take protective action as needed. Here's why. B is the best answer because the client has described possible imminent self-harm, including means and time frame. On NCE-style clinical questions, immediate safety assessment and protective action take priority over routine exploration or treatment planning. The counselor should assess intent, plan, means, immediacy, protective factors, and determine whether emergency intervention or a higher level of care is needed. A is not first, because exploring background can occur after safety is addressed. C is premature, because treatment planning comes after crisis triage. D is insufficient, because a no-harm contract alone does not replace a suicide risk assessment or needed safety intervention. Thanks for practicing with Flash Genius. For unlimited free practice tests, an AI tutor, and a personalized study plan for NC, visit flashgenius.net. Good luck on your exam!